podcast for this month from Tameside and Glossop and Ashton Primary Care Centre, here in the heart of Ashton under Lyne. It's part of our service that offers community healthcare services throughout Tameside and Glossop, working from 17 different locations and throughout people's homes. As you know from my previous podcasts, we've been running the Friends and Family Test as part of a national initiative since April this year. And I'm delighted to say that we've now got the first nationally published figures, referring to April, May and June. And our figures are excellent in terms of people saying that they would recommend our services to their friends and family. Unfortunately, I think our response rate is still too low, and we've got quite a lot of room for improvement there. But I know with staff help and with patients, we'll be able to get our response rate higher. Yet again, I have to talk about the accident and emergency standard of no patient waiting more than 4 hours, at least 95% of people within that standard. As you know, we've been doing a lot of work in this area and it's going well. Unfortunately, whilst we met many of the standards in May and June, in recent weeks it's proven difficult again, and we've had high numbers of people attending the department. Often large numbers in a small period of time, which has made it very difficult for us to be able to see and treat and care for those patients within the 4-hour standard. We've also got some difficulties around recruitment of one of the most essential parts of that service, and that's the accident and emergency consultants and middle grade doctors. We're looking to international recruitment, and we're trying to work with partners to come up with different and better ways of managing that recruitment. We've got 3 new board appointments. Last month I told you about the Chief Operating Officer, Jane Sumner, and now I'm delighted to be able to tell you we've appointed Jane Shaw as Director of Workforce and Organisational Development. Jane has been working with us on an interim capacity basis since the beginning of the year. We also have 2 new non-executive directors, and we've appointed them starting on the 1st of September. The first of these is Mike Cheshire, who is a well-known face around Greater Manchester, having taken regional, national roles and worked at Central Manchester hospitals in senior medical work. Mike Cheshire will be able to bring us his experience as a geriatrician and consultant in general medicine. The other appointment is also very well known locally, John Schultz, who was Chief Officer at the Council for 16 years in Stockport. And John brings with him not only local knowledge and experience, but will help us particularly with that interface with social care, which is very much part of our integration agenda. In terms of our work as part of the southern sector, and from that you'll recall it's work with South Manchester, East Cheshire, Tameside and ourselves, looking at wherever possible we can actually forge clinical and other partnership arrangements. We had a clinical congress with over 100 attendees recently, largely made up of consultants and clinicians such as nurses and therapists, who were able to start the discussions about how we could work together to provide services that are more resilient, robust, 24/7 cover across that wider population base. And in terms of our partnership, on the basis that we already manage services for community care in Tameside and Glossop, we are very much supporting Tameside Foundation Trust whilst they're trying to come to terms with the Bruce Kehoe report, which is requiring them to make improvements around quality, safety, resilience and governance. I'm really pleased to be able to say that we've now had confirmation from the specialist commissioners that we will be continuing to provide hyperacute stroke services from Stepping Hill Hospital, and that's for the population of southern Manchester. It's really good news for us because there was some consideration that those services may reduce and we may not be providing those services. But we have been confirmed, along with Salford Royal and Fairfield General Hospital in Bury, as the 3 hyperacute stroke units for Greater Manchester. And the even better news is they're going to expand those services over full 7 days working and including the majority of daytime and evening cover. We're looking to work with our commissioners in understanding exactly what their requirements are, and we hope to be producing that expanded service from early next year. As an organisation, we are utterly committed to the pursuit of good clinical outcomes and excellence of care. And as such, we've been very supportive of the morbidity and mortality information that's been coming out and will continue to come out over the coming months for a number of key service areas. Urology, bowel cancer and orthopaedics have all recently been published, and I'm pleased to say that we are below the national average in terms of mortality and morbidity information for each of these services, which are excellent services within the organisation. Similar to, but slightly different, we've recently had published hip and knee information, which shows that again we're providing the very best of care to those patients, and we look forward to continuing to promote that service as part of a southern sector offering. We've talked before about the public governor elections, and I'm pleased to say that we've now had those elections and received the results. And we've got 4 governors for each of the constituencies of Bramall and Cheadle and Marple and Stepping Hill. And I'm asking that the names of the successful governors are put in banners underneath this podcast so you can see who they are. It's good that they are a mixture of very experienced governors who have previously been governors here, being re-elected, and some new fresh faces that I know will provide a different aspect of assurance, challenge and support to the work of the organisation.